ahead and do it to whatever level. I'll be to me, I will move away from low social economic status. Yare a dozen sa community, sa group no. I'm a Yamia de Monhaton. When Yami won't share me new meaning or not domunti. Amen.
Amen. Amen. Dr. Chiden Fie, that was power. Next up, we have a friend, Dr. Benjamin Pokobediak.
Madam Asepa, Dr. Che, thank you so much once again for clearing that out for us. I think so on my part, the only thing I wanted to share, some of the new money, I'm up for whom said I was skipping that, and I wanted to just briefly share that to know with that, so that I think that last year you kasa a lot about the digestive work, and I think that I'm hearing wonderful testimonies about everyone putting the digestive work, the 10 minutes digestive work. We said at the end of today, which happens to be the day, 2 lifestyle changes that you need to make, and I think that I know, and I'm so convinced that all the people that have been here, at least I'm hearing stories of people putting in some lifestyle changes, and I'm so thrilled. Say at least we're able to meet the expectations near work for this program. Now, one of the other things that I may kind was the fact that said, motion is lotion. We get lubricated and everything. Most times, my own uncle was asking me, said, then this is Yare anyway, say back. He says he was going to ask me, but one of the things we all know is that anytime, like I mentioned last on Tuesday, on Monday, whenever we are not moving, we are stagnant. Our tissues and ligaments, get tight, and then they cannot move. And in one of the research, like we put on here, he says that exercise is one of the most powerful and underutilized medicines we have to offer. For instance, and then my church pastor was preaching a very powerful preaching about the importance of laughter. Anyway, saying, now one of the things when he said, even a 6-mile run just stimulate endorphins, which is equivalent to about 10 milligrams of morphine. So these are the things we are talking about. We are talking about internal medicine cabinet. I think Dr. Ken Moha or Metrama, but I think that for you to even get morphine, I think that Dr. Ken, I think that you help me out. It takes, you need to get some level of clearance and sending amount that way, say, But these are things that you can actually get your body to secrete freely just by being active. So there are so many evidence to show some of these things, and there are tons of research just to prove, we say, if we can move ourselves from being a couch potato to somebody who is kind of like active, walking, dog walk. I'm saying Ghana for the can't dog walker. We don't actually. But I said, Dr. Here to me, sir, we might not do dog walk, but I believe he said there may be so many things. Yeah, common kitty. There's a program on around radio in common kitty, yeah, dear. And common kitty, we can do them common kitty by what? Walking. And that can actually help us. Bicycle, like riding a bike, and all. We have so many nice trails around us. And those are the things that give it to me at the aba. Now, no, dear conclude, no. There are some of us, we want to incorporate some of this active lifestyle, and will be the question about say there have been situations where we'll be exercise, maybe when yes, we are collapse and all those things, and one of the things, for instance, at the beginning of the year, January, you see a lot of people register for fitness. Then after the first week, all of them crash. Or more registration, they don't go back again. The question is, why? And as my background in pain neuroscience, and I want to tie that in with that quickly, and then we are done. Idea has is what we call the circle of tolerance. Okay. Now, this circle of tolerance represent your tolerance to activity. Most time, in our mind, your activity, you're doing say you're human. But bear in mind, sell kobo job for 10 hours. Now babe no aduane for 4 hours. And I will see Nioma and I will they are all part of your activities. And most times, as far as your activities fit into your tolerance, you are okay. And in fact, say, until no question back when I say your work is not a workout. Your work is not a workout in that most of them have to fit into your tolerance. So, for instance, so you'll be out here. The question is, who use back muscles in the for a long time? Who you'll be our left here? You're using your back and your hands to lift. Normally, what we call the PDL, the physical demand level, the CDC, and then the labor department, what criteria measure what they call the PDL, the physical demand level of everybody, whether you are sedentary or you are active. Now, we hear the physical demand level now, it put a tone on your body. But as soon as all your activities fit into your tolerance, you're okay. For instance, and I always want to relate it to money again. For instance, our budget and other kind education and wasem. Assuming say our education and cost into income level and you lower. Now me say who make him say in a month who make it $1,000. Now say will expenditure $2,000. Meaning say every month you have a deficiency of what? $1,000. In terms of your body, this is what happens. Assuming occasionally we do too much too soon, when we've done too little for too long. We do too much too soon when we've done too little for too long. And today is what happened. We income near 1,000. But we expenditure instead say can you maybe a here and we be spreading it out and be a bit more cover no and I will call what is your sales and I sell also income nindru and I will spend it 2,000 within that short time meaning say you are having a deficit of what 1,000. The same way in your body the main fan say over a capacity of 1,000 and I will call sorry, Juma probably won't lift the weight of about 50 pounds. And I'll call and our tolerance a 10. Wouldn't need because you've not actually built your back muscles. And I'll call Dr. Philip Daken and the year could not lift in the 50 pounds. We now say we see as I say a year there. Meaning say your activity has exceeded what? Your tolerance and you run a deficit. So deficit now running in terms of money and in terms of your tissues, that is the pain. Because your body is sad that say you have 45 miles of nerves in your body, which normally what they do is they say, anytime your activity exceeds your tolerance, it triggers a fire alarm. And pain is 100% produced by your brain. And that's why the issue of our mental health is also important. Produced by your brain in response to a threat. Until anytime be a work CD, we are too much at that point, what trigger an alarm? You've triggered a threat from your tissues, and that's when the pain comes in. And for a lot of these people, the reason why I want to is because ya can start here. Don't go now or snanopa and con 5 miles when you've never even walked 3 blocks in more than a year. Start gradually, if you do too much too soon, women say some of your activities have started falling outside this tolerance and now on. And this say now you've done too little until amount tolerance now I shrink it. Until I say COVID by where Juma swire income on the swat until first in the way I will say spending, you cannot spend the same way. If you want to go back and spend that way, meaning say you need to increase your income. Especially in a situation whereby your expenses is fixed. And the main fan say, well, expenses and then say, where do man unyaye? Wo man I so take care of, who could I so take care of? Oh, papa I so take care of for year anyway. Say, and the meaning say, will physical demand level sign, but who use muscles, It meaning if you want to go further, then you need to build these tissues up. And basically, that is the concept I say. Because you create what we call an imbalance, where your activity exceeds your tolerance or your tolerance falls below your activity. Anytime you have this kind of imbalance, then that is when things begin to hurt. Until when as we go further and we want to incorporate some of these things, we have what we call graded exposure. Gradually build yourself up. It is not a competition. Ebia me running 8 miles within 1.5 hours. Don't try say you want to. No, you're not competing with anyone. You're only trying to improve yourself. Start gradually. Even if you can start 5 minutes, I bet you say if you can start with 5 minutes consistently, you are better off than somebody who's doing nothing. And so what shall I say 5 minutes? Now you say every week with the 1 minute back one. Imagine within 2 months, you realize that 10 minutes, 30 minutes now you can average you should be able to make wait me then achieve it. Consistency, like the finance people will tell us in saving, consistency is key. Just being consistent and regular will make all the change. In the MSA, Hana Mediano ABC. Dr. Frank.
All right, Dr. Ben, Sharp. Mr. says so all questions are just note them down. Yeah. Speakers and you go through the summaries new year, by my time I will be able to send a question. There it was so Dr. Frida, the topic near diet, achieving and maintaining a healthy weight. See, Dr. Frida.
I was on Tuesday at Isiano. Now you can't diet and maintaining a healthy weight. I'm in slideshow and I'm in share from the screen. Questions be brave by regarding how to read the nutritional label. No, intimate the sample nutrition label at to screen or so. See a nutritional label na eka enyama be brave actually not a lot of information from it. Inti this example of a whole wheat bread, no. You want to say, my highlighted the serving size, the recommended size, and our portion, as I said, would one slice to get 110 calories. In TA, first, I had the same deficiency in knowledge. When I saw 110 calories, now my dream is say the whole loaf of bread, no pan, no, all the slices, no, 110. But entesa serving size, one slice, no, now so grams is just how much I dare no away. Send ya more do efa. Inti one slice 43 grams, just say weigh it on the scale, that's how much it weighs. There's 17 servings in one whole bag of bread. Inti Saudi, all 17. Now you have to multiply 17 times 110. Inti Saudi ba konswa, it has 1.5 grams of total fat, which is 2% of SA 110. No. So the calories, no much in percentages. In 2D one slice, ubenya 2% of total fat. Saturated fat is 3%. Cholesterol 0%. Sodium 130 milligrams, which is 5% of the calories. Carbohydrates 21 grams, which is 7% of the calories. And fiber, dietary fiber is 8% of the calories. In tiadia bakwa, me pese ya pointed out, So anyamani bebro what, senya ya can last time, it is very deceitful, especially, so the ingredients are. You don't want ingredients a lot of chemical names, tin. No matrona kakraka, like names that you can't recognize. Bibi to say, sugar, salt, flour, those are easily recognizable ingredients. And to say, do you know what a lot of chemical names I mean say and you're natural. And a lot of modifications now now the ingredients are not whole food ingredients. Senya. Your kind of Tuesday, the original diet, had a lot of whole foods, and yet processed, yang manipulating the bread, it is raw. In the raw form, amount the most benefit, chance say ube manipulating. Now, me saturated fat in quano, according to American Heart Association, no, saturated fat recommended for consumption. No, you want to achieve between 5 to 6% of the calories. In an average diet of 2,000 calories, you can have no more than 120 of the calories from saturated fat. And so saturated fat so crab. Into the best option is set, which is about 13 grams. Into some kind of grams near the weight of eduane. Into social label na so na 1.5 of the total of the saturated fat. No, when they said 13 grams now open it per day. No, now you have to subtract 1.5 from it. It's a way the movie. So the whole day in internet, Dr. Eldecheka said, we have to be intentional with our diet. Okay, say, twasono. It gives you different examples of the fats: trans fat, saturated fat, and unsaturated fat. Trans fat and the saturated fats, no, those are the ones you want to minimize or avoid. Ebine, hydrogenated vegetable oils, fast foods, cake, chocolate, deep fried food, and yama yachichino. And then saturated fats, palm oil is a saturated fat. Just take 1 tablespoon. Nancy, we use more than that. We use more than that. I say, you have to control your portions. At least what to so. Animal fats and saturated fats. The best one to have is the unsaturated fat, whether it's polyunsaturated or monounsaturated. Olive oil, any nuts, avocado, salmon, tuna, those have unsaturated fat. And so it doesn't mean that no bro, because at the end of the day, no, you still have to maintain your portions. And then salt, and yes, salt, you have to take it out of your diet, but you have to stay within a limit. Or blood pressure crampuna, they tell you, say, you cannot live without salt. Salt, so the amount per day, even less than 1,000 milligrams a day to improve your overall health. According to American Heart Association, a member should not consume more than 9 teaspoons of sugar per day, and a man so lower than 6 teaspoons per day. Senke what time I bet me when sugar see did too much etimi a honey pedriano. Now fiber ya dear me percent and on it is extremely important in our diet. And we should try to at least get 21 to 25 grams of fiber. Fiber, and on that, it works in our digestive system. It moves the out. So to make sure, say, you are regular. And member should get between 30 to 38 per day. And I'm listed in Yama, in Mianya, etimi maya fiber. And TCF, Ghana, and Yanana, Tuesday, Namide pictures, actually. Bibi to say fufone, bayirene, bankunem sano. It is loaded with calories. And so you'll be to maintain your weight or lose weight. No, you need to eat about 1,700 calories. Say udi bankua. Last time namenka 1 banku ball is 248 calories. And out of the 1,700 calories, no bankuna kwa onfa stew and kruma stew and I say bokone fish and kahono. You have already spent 248. So you have to make sure, say, why you're aware of how much to eat. And just say, you just eat it like that. Ghana is very rich. I know, say, it tastes so good, but it is loaded into obia wedi fufu kesia sano. It means that you have spent more than 1,700 calories in just one meal, because fish want the calories. Fufonos want the calories, and namne and quine bibiano want the calories. Intine a portion control no. Inti and area the Medija Mona said, be deliberate. Yes, count the calories. Be intentional. be mindful. Nyame bɛboa yɛn. Damase.
Yes, sir, that was it, Dr. Frida. Next up, Dr. Hannah, the topic is coping with stress.
Thank you. Thank you, Dr. Frida. So, something that I want to bring up and ensure, say, you understanding, and may at this point, let me go ahead and share my screen. Okay. So we talked about coping with stress, and I know, say, Dr. Che Ekra Emma feedback on the stress and the effects of cortisol in the body. Into just a few points, me address, and I may answer another thing that came up. Into cortisol now, yekasa release, is going to cause a lot of these effects now, yeshe on the side of the screen. Me can't say a bit me hawa. One of those release of glucose in the body. If you're under constant stress, now stress hormone cortisol release, you're gonna break down proteins from your liver. You're gonna get glucose running in your bloodstream. Now, so why you so exercise, burning some of those glucose now, you're going to end up storing them as fat into you be obese, and then that will lead on to some of the complications. Now, about wakumano. You're going to end up with high risk for high cholesterol, heart attack, and then possibly stroke. Intimepacho symptoms of the stress, now we share, now we baby, now we cope, like we mentioned. No, the other thing I wanted to go over, and I'm not sure why my slide will not go to the next page, was the compassion fatigue. Compassion fatigue, there are some physical and emotional impact of that. I got somebody that reached out to me after the presentation, taking care of Obi or Yare for a long time. It can be very, very hard. So when you say these symptoms now, you are almost like burned out. Try and get some help. Say be crowd to me, say nipano or ahanas or insurance. You can maybe get some nursing assistant in the home to help with the taking care of them, And I say, oh, bushiaphobia, relieve. Because when you're under constant stress and these physical and emotional symptoms, it's going to just get worse, and then you're going to get sick eventually. As I said, Bibi to say emotionally, if you're under constant level of anxiety, and no cortisol, you're going to end up having a lot of cortisol secretion in your body that's going to cause you some complications in the long run. If you're depressed, depression is going to end up making you not feel good about yourself. You're going to be emotionally unstable. If you're suicidal, that make us say suicide every 40 seconds. We have about one person that's dying in with suicide. This is about, you find say 1 hour, I'm said Danamekano. You find say about 1 hour, nipa 90 in a baby within the next hour from suicide is very detrimental. You can't help yourself at some point when your brain decides to go another way than what you want it to go. And so help is available. You can cope with this with the help of God, and also using what has been proven to be supportive for sa Niekosonom. There controversial feedback from, I mentioned yoga and the data that shows that yoga and meditation helps to control or to cope with stress. And what I had meant to say is not relating yoga in a spiritual way, because I do know many thousands years ago, this was something that was derived from Buddhism, Hinduism, and that is definitely not what I'm trying to portray, because Seventh-day Adventist. However, the movements that came out of yoga, from the time it was found or studied, is what I was recommending, because scientifically, there are benefits to this. So we call internet or type of benefits of yoga. You will get a lot of things, and there's something here that I want to read to you with regards to that. Now, or say the U.S. military, the National Institute of Health, and other large organizations are listening to and incorporating scientific validation of yoga values in healthcare. Doctors will recommend your patients to a yoga therapist, and not the NSC do extreme. That is not what I'm saying, because yoga therapists, why? They're going to use some of those things that maybe it will have some spiritual entanglement with it. May let me go and say the movements that are recommended with yoga activities. So BB, for example, like this tree pose now, it really helps you balance and keeps your muscles flexible. In BB saying, oh yeah, so you are taking in deep breaths while a soft music, maybe classical hymns being play in the background. Your goal is to try and relax your body with those movements now, so physically into one point. Another pose, say a cat-cow pose, and also a bow with your stretching of your muscles and improving flexibility. Dr. Ben Mo Ebeka say, your back muscle, your back joints in the idea, they are vital to your overall health. So we achieve don't pin any idea and how into this pose, for example, to really improve your flexibility in your torso and then also in your back. It's your choice if you want to incorporate this again for the scientific benefits, but not for the spiritual part of it. This is one of my favorites because our movement we this is the legs up the wall pose. Just think about gravity, so you're getting a lot of relaxation to your brain, which is controlling many parts of your body. So this pose helps to relax you and helps you to even sleep. Maybe why a tense, why a stressed out, music be in the background, you've turned off the light and you're just doing this pose. It's gonna put you at ease, it's going to relax you. You can definitely sleep better. I know it has helped me in the past because it works. So I wanted to recommend that. And then somebody was mentioning, said, make us an say, like fufu we make me have maybe the broccoli be guso. Obisi na broccoli ni fufu dear. How do we even eat that for for most of our Ghanaian communities? Maybe you're not used to that. It's okay. Dr. Frida Kasano, say 1 cup of broccoli is about 5 grams of fiber. Into fiber is definitely something you need in your diet to help you with your regulation. Into broccoli na maybe I'll be to me carrots. So carrots na maybe you can do spinach. Anything that has green leafy vegetables in general is what we're recommending to help you balance your diet. Into again, we're giving you recommendations. You make the choices on things that will help you. We're giving you the foundation and yet prescription. So I hope this helps you so that continuing together along with all of us, we can cope with stress in our lives. And again, music is a great support for us. Remember that you ought to keep a cheerful heart. At this one, however, remember, sir, when your heart rejoiceth, you are actually doing yourself good. Also keep a joyful heart, because if the universe owner, the God of the universe, and your friend is say what else do we have to worry about? We will do our part and leave the rest to him, and he will help us through it. And I thank you for this opportunity again, and I wish you all the best in your healthy lifestyle choices. Amen.
Amen. That's it, Dr. Henry. The next speaker, Dr. Philip Ofori to me, the topic is dealing with dependencies and addictions.
Yo, Dr. Usu, yeah, that's it. Unfortunately, some book I didn't mean to, but the sound of food excites me. So maybe the idea of dependencies and addiction. But I have a confession to make though before I move on. Dr. Frida, maybe the NSA. So Ghana, I have not 2 aims. 1, to release stress, which is Dr. Hannah again. 2, say because we didn't near Metia Minyendi. But the end they have is a withdraw be diba koda no pana. After the night shame of me because I want to be able to eat. But we didn't did that much into the chair. So that leads me to my topic, right? Addiction. I don't know what your addiction is, but I want to say addiction, you want to be brave and yet discriminatory. Me pacho yes ka for yare and here for yare. And enye sebio yenso you pay the adeno yare, right? We want more pay the anesa, but then they have an addiction to something in particular. Okay, addiction so you're limited to aduane. And you know, your new maybe it puts us at risk. And my one you bet me I addicted to baby. And you know, and you maybe not put you at risk, you know, and I say a risk factors, you know, it be your genes and make us about nature versus nurture. Your boss say I see boy. And as I say, you nipa buy no. And you know, everyone who na run it through their family. But if be not one another, they no koye and sa. Uwa baby who Christo into no sa. And be an addiction of baby before for. Your how so say be addicted to a substance and as I say anything at all. It affected the formation of our brain. No, and you know, a money day say after the big jai. And in terms of your environment, and also no, our neighborhood, maybe a benny enough for a befa, for a no mobile grow, son many no, it may affect you. Then it affects the choices that we make. If you want my own make us and then the woman tia, yes, say curiosity kills the cat. Sir, and your man after the uncle Jima. Okay, and your maybe son, it be addicted to the decay a media enemy. Ediane. Oh, and the enemy who do be last, Mammy Odum, MBA who yet done as I saw share Nediano, none of the popcorn. You might think, say, no, so dear. Yes, Obia day different. Obo no more, ye man, no, I started AD, I law, Shre, and yes, I knew man, those piker foods now, after the Obe, you know, now I become honum not Upebi Eddie all the time. And I abuse the sex. When we talk about sex, I think the other day I didn't stress so much on that. It's not just actively being involved with your partner. Then they start going around. They start masturbating and all of that. Then gaming. It has become so convenient to become addicted to game. And as I say, gaming. Okay. And I also say betting. Because right now, no, they've linked it to something that we like, which is sports. And they've also brought it on our phone. Into a convenient and I don't know what about social media or internet addiction. Because say anytime you're addicted to something, no, say if you have the withdrawal symptoms. Into a board was or peer pet not ordinance a bonny bottom, maybe or take keeping the phone. Because who say new on feeling okay, they have to make sure that they have it before they can step up. Maybe Opie I do on my basis here, but the phone can hold crampo now on to me and no honum. And some about drugs, you know, the prescribed and unprescribed. And there's a very important point. Dr. Ben Opoku Bediako Ekaime, legal does not mean safe. Once again, popcorn is illegal, but it wasn't safe for her. And apart from that, you know, crampo. Legal does not mean safe. Alcohol is legal, and so it's safe in my marijuana is legal in some states, but it's safe in my so there's a way say no doctor the prescribing man I or prescribing more, but it does not also mean that you cannot be addicted to it. Midi no make us say behavior you did so many years are forming no to me and switching off at once. And to one, yeah, accept said there's a problem. Two, yenye or pen say ye debe ebe disum kunim. Na yenti say and yes switch no dum no aso. Until it may take a time. Finally, it is okay to have Christ and to have a therapist. May that's it.
And also Dr. Philippo for reading to me. Last but definitely not the least, Dr. Kennedy. The topic in here, preventive exams and safety. Dr. Kennedy, don't go.
Okay, me da so so be atomenka.
Yes.
Yeah. Okay. And media no member disclaimer kakra. The title no say preventive exams and safety. Preventive. Tiwanya anya sa yarena via. This does not apply to you. Sa testing intervals on the mind, it does not apply to you. So we be a question about blood pressure testing. So our hypertension, our monitoring system is different from we are only be. You say preventive exams into obi our own nyanya. Otherwise we are healthy. Oh, I send my year can. And it's okasa the risk factor and T. And I say we are being home tea. Come every year. And I mean check it out. That's different from say 1 year already. Also, my example back say be a okoy and 1 year already. And the amount drew the amount 2 refills. The idea is say refills not sign. You're supposed to come back and see the doctor. Not on evaluate to where he will be a word drew. And so you're already. Those timelines now in terms of testing doesn't apply to you. Where or more otherwise healthy, and I yet testing or more. And to acquire first testing a normal, you have a time period I want some be in your check as opposed to be a acquire and not testing any normal. 10% me kind. And I also colorectal exams, there's some updates on the testing age, make I say 50 plus, but it's actually 45 to 45. No, I shall say a regular testing to 75. And now between 76 to 85, and only doctor and discuss it to see what's the benefit of it. We are over 85, then it's not really something I'm going to recommend amount. And even 45, so inflammatory bowel disease, be like Crohn's disease, and I say ulcer, you are recommended to even take it earlier. I know Dr. Kambama why I started to cry earlier than 45. And I say, a family history of it, recommended to be taken before the 45. And last number some once again about safety, and do not near can once and say some of us it take key like your friend Abibi drew. And say and also a year drew into sometimes combined with Western medicine, it can affect you in an unsafe way. And he said, oh, I got a new doctor. I'm sure say be our catch and say me take you anywhere will be whom I do not all but ABA bringing on one thing credit neither. And the best say you can try to find the English name of adrenal will take and I say herbal adrenal will take be so so wait to find the English name now. So I know what my catch or doctor know who say okay, you also take away. And yeah, can most of the time say and affect in a bad way. It's okay. Because I continue to take it, but I be affected why and also they will inform you. And I'm say and last thing your OTs near can't want some around. OTs just because on by yourself, no prescription. What cause CVS, Walmart, Walgreens, Aquatono doesn't mean say and also you can just take it anyhow. It doesn't mean say it's 100% safe for you because your condition, might require you to do something else. And to know it also be brave. Dr. Kasa, or you can even ask your pharmacist based on your condition, they can recommend one medication and answer another medication. Now I mean clarify and it will be a bar last time. That was it.
That was a pioneer, I'm sure, Dr. Kennedy. On the lighter side, Dr. Kennedy, go ahead, Reverend is saying. Okay. Presenters say Yankopon Shamo pa my boy and yeah this week. At this time it be floor number so be what questions that we have about an hour. Your panel in now how be address the questions in my now before so be first person be kind ban who said there's a question in the chat. Dr. Ben not what the kind of note. Said Dr. Ben, if you can unmute yourself now, answer that question, Amaya. Okay. Question if free, Kofi or Arisafo. Or say, can repeated daily workout routine therefore become part of the tolerance?
The answer is yes. Your repeated daily routine, also become part of your tolerance. It's in American can say initially, like the things you do every day, everything that goes into your daily activity, even standing to brush your teeth, is also part of your tolerance. You'll be amazed how many people cannot stand on their legs and then brush. Even just getting up from seated position, you have how many people? Because it involves something we call some biomechanics of your joints and muscles working together for that to happen. So we need that kind of strength. Sometimes we don't need more. Just imagine Obia. Sometimes we will see from the stairs. If you are getting down the stairs and I say you are climbing up the stairs, mostly having the stairs and it's very common. Now, when you have a knee or problem, imagine if you're quite over so, I will get it down or up the stairs. When so be quite better, no, I done anything. Now we'll see because you've changed the biomechanics and muscles don't have the tolerance to do that. Most time when the panel cross sorry, when so no what coin musa, but I was sorry straight away now So the point is that your daily workouts will become part of your tolerance. Until the drew baby as your tolerance increases, we say like we mentioned 5 minutes and after always 5 minutes in pursue. Let me use the word. But say, well, say you need to kind of like what? Increase it. Because as you increase your capacity, some of the little things, 5 minutes, is nothing. Like I tell people, say, if you have, I don't think say Jeff Bezos' wife, say be a 10 iPhone 13 Pro Max, she would worry. Why? Because she has a whole pool of financial resources. So 10 iPhone Pro Max will not be anything. But what to say many I don't think say we must spend money to buy 10 iPhone Pro Max. Even you say so those are some of the things say we need to have our workout, therefore will become part of our tolerance. You need to put all those things in. And as you continue to use the workout as your maintenance and as an income, you can get all those things happening. The other thing I wanted to touch on was, Dr. Hannah, since I am on the platform, then I will just help out with that. What I did about Dr. Hannah Kanye, I want to reiterate it. Basically, this yoga principle she's talking about, it's more about flexibility. And probably I failed to mention that mostly the exercise principles have what we call the FIT principle. FITT. It is an acronym meaning frequency, intensity, time, and type. Frequency, intensity, time, and type. Yet until I lay the foundation, they say yes. One of the biggest predictors of death was cardiovascular endurance, or I say low fitness. And until I may pass you used to walk in any way, to build that one up. We need to go further. That is what we talk about, the other type of exercises. And the flexibility is part of it. And that is where the issue about yoga need some of this flexibility, because the cat cow, it is not exclusively to yoga. Dr. Hannah showing the legs laying on your back and doing weights is not exclusively. Those are exercises that are done. Yoga for have incorporated or adopted as part of them. Yeah, we'll be able to say child pose, doing that. It helps with the knees and then the back. Those are flexibility stuff. And to even go further, the whole aspect of the meditation, mostly, it's just about the name, semantics. The whole about meditation and closing and taking it is more of what? Breathing exercise. Now, if I can just chip in just a little bit, Dr. Frank, the point is that most of us don't know, say, your diaphragm now, the home is a muscle. It's a muscle. Now, I had to say a dome. The interesting part, and it says our diaphragm, and what the costal part, and I say, your ribs, and the chest escalation. There's another part of it, attaching to your 5 lumbar vertebrae, L1 to L5. It's attached to it. The other interesting thing is that your hip muscles now your tenacity with me a page of to the bathroom doing walking almost attachment and most times say or hip near tight because you are sitting so much it changes what we call the mediastinum, the position of the diaphragm. It pulls it into say there was some space. I'm trying not to go into the technicalities, but there was a space behind your back. I call it the zone of apposition. Says that space near reduce, meaning at resting stage, nipa diaphragm is not in a position to expand. And what happened is most people will start using what we call accessory muscles. Accessory muscles in here, or muscles ne what has no, traps, Once people stress are in their shoulders. Most people use that. Was into your case obi air hyperventilator. Was it saying oh yeah? Most times a person ni pan relax here. Then you can then do deep breathing. The deep breathing aspect simply is that whenever you do that deep breathing, in we say now, one nerve will be a friend, say phrenic nerve that comes all the way from your neck, and then a supply will diaphragm with innervation. The funny thing is that anytime Biana obey that different, it connected your parasympathetic system and will calm it down. And that is the scientific, like the physiological process. We can go into details, but a so link. And now sometimes, as a clinician, now with my Christian background, I say God says that we are fearfully and wonderfully what? Made. And those are some of the neoma we need to have at back of our mind. They say the whole aspect of that is more about taking the deep breath, kicking in your parasympathetic system, so a bit calm your body down. And that is what mostly you want to do. Because when the stress in any way is in a bar, by laying down, I say one of the posts of Dr. Hannah Cancer or Pepper, what that works now. Now don't not to one, so now don't not to a kunyaswa. Now don't start to with tamiswa. What we call teaching, what we call normal deep breathing. Now we breathe it through your stomach. You take deep breath through your nostrils and out through your mouth. And then you see your stomach come up and down instead of your chest. Now it calms you down. So basically, those are some of the neoma here can once say it can help reduce the stress, and then couple that with the music and the prayer. What a better way as a Christian to help deal with the stress is knowing say we have a God that can help you out with that.
Dr. Bened, I have another question for you, but you take a sip of water and then call Dr. Frida. You better also.
Okay.
Elder Eben Wilson, Dr. Frida, say, do we strictly have to measure every single day we eat?
Yo, Medase, question, you're very important. The mechanic said yes, because if you want to maintain a healthy weight, now why your calculation for your basal metabolic rate, and now said how many calories you should eat in a day. My example during the Tuesday at the Siana says, if you calculate your age, your weight, and you're a female, now what we see 1,700 calories per day. So did you grow 1,700 calories a day? Gain weight. If you eat under 1,700 calories, you will lose weight. 1,700 you'll maintain. So depending on what the objective you're trying to achieve, whether you want to lose or maintain. And the analogy I'll put it, and I said, back to money, Senior Dr. Ben Erkano. Say amount $1,700. That's all you have to spend in a day. Into unko, you sitting on just an opponent kwase is supposed to sustain you for the whole day. Intina is better say out of the 1,700, no. So did you 3 times a day at Chimu 3. Nadi kakra, ebia 700 calories in the morning. You want to eat your most calories in the day, early in the day, because while you're most active early in the day, there's more tendency. So burn it that, Not be at lunch, what the 500, not dinner, what the 5, or ubedi more in the lunch, no what to so dinner. So you eat like a king in the morning, not afternoon, you're eating like a queen, not in the evening, no, you eat like a pauper, like somebody at Onisika. So that way, no, Senya Dr. Ben Kine, you go to bed empty. After you've done your digestive walk, no, you go to bed empty and then you come in the morning. So yes, it is intentional. You have to be mindful to really watch the calories and stick within the limits. Medasi.
Okay, a quick follow-up, Auntie. Given the fact that Ghanaians and most of our food do not come with labels, how do you go about measuring our calories in the diet that we be eating?
Yes, actually, no. We used to now make sure Ghanaian measurements here fakakrebi na shese any yese ano fakakrebi. There is no measurements. But thank God India koso senya mekaya no. When you research Banku first, no, now we didn't know how many calories was in Banku. Now no the quantity we are Banku it's 248 calories for one Banku ball, and that is the size of your fist, the neck kakako, just a small one. And now you want to use the portion control now you can, because in piano no, we do not have the measurements. So after you have made the meal, no, watch the portion size. It should fit in the palm of your hand. Right? Because we're not living to eat, we're eating to live. Now, if you eat more than that, when it says $1,700, no, it's what it. By the time the day will go, maybe I'm not count $2. You have to eat $2 worth of a meal, which is your vegetables, broccoli, green leafy, Dr. Hannah Kayano. You have to be mindful. Now I balance it. Okay, I will spend here and you may make sure that I'll be below budget, balance it. And you exercise to burn it off. You know, so deep knows that you have to work like an Olympic champion just to get that calories off. And you have to watch it just like money. You won't overspend, you won't have that money to spend. Sami I see a share of calories. That's it.
That's a part of the Frida. Obi din at 514 AMW and son and ombe or mutini Panama Nabano. Dr. Hannah, now person answer question. We will say what causes muscle pull in pregnancy, and should that be a concern?
Yeah. So muscle pulling or having muscle concerns in your pregnancy, ABI, it depends on where the muscle pull is. It could be, say, ABI is a nerve where the baby during your second, third trimester, and from 6 months or air corner or 3 months work corner, sorry. It could be say na baby or dano maybe or pressing on some nerves be in the back or in your diaphragm or in your uterus, that whole section, or that could cause some problems with muscle or pain. Maybe I now didn't say a muscle, but maybe it's just pain because of nerve problem. And that's maybe a deficiency with some important minerals that you need to take when you're pregnant, because it helps you, stay healthy with your blood pressure, with anyone so nutrients are we here to feel okay. Bibi to say magnesium. I know a lot of the prenatal vitamins now prescribe or they recommend for pregnant women to take. Usually doesn't feel good when you take it. I usually took them at night, because if I took them during the day, so if that is the case, I'll try and take it at a time where you wouldn't feel the nausea or vomiting associated with it. Make sure magnesium level is okay. Make sure your calcium level is okay, because and also boil with your muscle. Other than that, if it is everything is normal and you're just having the muscle problem, then it could be just normal way of how the baby is positioned in your uterus and how it's causing you to feel, because aprano oil can see in your uterus. I hope that helps to clear your question. Thank you.
Right, thank you very much.
Dr. Frank, can I just just a little bit just to add to that?
Yeah, for sure.
Another thing that can also cause muscle especially when it comes to a lot of like fluid accumulation, that can also cause some of the muscle pull, because you don't want that active kind of like pseudo inflammation happening around those areas, because when that happens, the muscles are not getting that nutrition in a constant way, because fluid in that and some sort of like retention of it has to go up. And sometimes you have a lot of women having that problem, and also it's one of the reasons why muscle pull, and sometimes like they laying on their back and lifting their legs to say, Dr. Hannah, and doing what we call the static contractions with their leg, and they go up and down like that, and it's able to bring the fluid and like elevation, we're able to draw the fluid, and able to get a relief of that.
Okay, Dr. Ben, hang on. You're the subject of muscle pull. Minimobia or statistical exercise kakrabia na unya contractions, ne abdominal cramps near day. Nippers are then a cause, and what can they do to prevent sudden?
Most times, for such a person, I always want to integrate what one or more hydration level. Okay, and two, what exactly do they do? What exactly like the exercise, and sometimes even their diet before the exercise.
Okay.
Because sometimes like the kind of what the banquet is say sometimes you can have, sometimes for people it's not like that. If you don't cramp on like or more like when they start to in the if they've not done that for such a long time or more into ways why you're uncomfortable. That is why we sometimes tell, like we've been advocating, say start gradually, because the tissues, for most people, when it happened that it's kind of like a shock to the body because that activity have not been done, and the body is trying to find its kind of like way out of it. But if you're able to start gradually, now we are consistent, it gives body enough room to kind of like make gradual adjustment. Right. Into what our advice and on one shall say with simple exercise, something like our digestive work we talked about. Start gradually, start with the walking, and then you can just be making progressive changes as you go along.
Okay. That's a part. And make call mama page on 514 AMW.
You I'm penny for Madam was a doctor for a mom dear boy. Say Mamba because many a coffee man be. Said ye will see na brabon me car on Tiasia, de bia bay full year and Nedia bay full vacation. Because the new de any kuno. I quite sorry I want to. Now me question is me stressing on the need for annual checkup physicals. Any idea me per se multi there because my cycle you a chef answer na me could be. So na me call and who said and for so I was so happy. So I'm say last time I hear be far say be a kum ye busu ni bi ana bibisa. Make I said 2019 mini aba oyare confirmation cool year. Now the only way a mammy who ye kun say I have to pay for a test. The test was expensive. Even we in the creation, I still have to pay. And sometimes it do maybe a opasunya near opasunya new year. It do maybe our cell bomb more than say obesa. And I think say yenny ya phone kasa because men and none meton pan say me father none impansa nana beto na no munim ne kunkum o mabusuafo empanifo no omunim enti minim se ye aka mamu abusua bia nim ne kumema enti se ubusa we den abusa beka mi atro na also nyanso ano abomodin se obema omma no hu na nyese bia hu na wo ana afia bayifo na ye wo nemum aduane die ne lifestyle be adapt e be boa wo no na also why sase na be ya aganyame bema wo uti ajima konkon ache na abayifo nso yemfa nkwahwom se omo na akuen that's it.
But as a person, I for the next person, me comment on issues I raise here. First of all, most Ghanaians, I don't know, say exposure to them. Of course, person that doctor prescribe a drona. Ombusa said doctor then a drona or the man and I know akono. And most of them know nim the integral on no medrono. And sometimes I know more for doctors in the they are not very tolerant because almost any probably over a short period of time. Omubusa questions but yeah stressing share and crop for more Ghana no. It's your health. As you advocate for your own health. It's your right to know say a drug doctor edema yare win no dema me and say yare win. Another thing about cause of death, I'm say a UB Ghana says nipani who outside of the hospital settings and by law no, they are required to do an autopsy. And an autopsy in a crime almost said, Nancy, there was a documentary on the state of mortuaries in Ghana. Or is an eyesore. They are more piling nipani going to autopsy, no. Make come from Ghana health system anymore. For a long time, here called Morga Confanoche. Cause of death, over say autopsies 10, bear 8 of them the same cause of death. Because on time any thorough autopsy and who the actual cause of death now a man the actual cause a man nipani ewu. And these are all some of the things that bet me to you for now take your more health and more checkups seriously. I can tell you that me practice Ghana for a long time. Not one single time no be buy over for maybe an annual physical. And also buy because say on your riba we na promote. Ghana I call hospital, young hospital and say you call for treatment. You call for preventive health. And for there are more private hospitals, private insurances or Ghana. You move a break atria for families back home. And I encourage you no use insurance no and call for regular routine checkups na boy empire. There was another hand, Mr. Butters. Okay, so Mr. Butters in anywhere. Dr. Yentumi, no people say, how do you deal with addictions on Kolemu? Especially younger ones now, they are addicted to their tablets or more laptops, and I don't know. How do we go about dealing with that?
What you made that say? Who's say bank right now? Dealing with them, talking to them about so and maybe a war so maybe a 1 year no exercise here. Sometimes one can sensitivity issues into one here baby na obota ya what they can na kwa jinsemu. But you follow me, sir. And sometimes so only more we have to be very mindful. But to the specific question as to tablets, first of all, answer about more or the more no, also settle limits with them. Tablets and for a daily use. And I also say and for debia and also wunya. Right? It is not more or less a right of yours. Say we only tablet and also have it for X period of time. And I was saying more to begin with. A bad now on say if you are there, you may they call me a program so we said there we are for 1 hour. Then there is that established relationship and I say understanding no ever hono. So about so go through middle adolescents side and no more phones near there. Say you do more a chassis and I say you do more chassis. Near more who the danger of having these devices for extended period of time on near there. A bedroom or no more in Tiasibia or more award the independence to have it no crampono or more side in Yinaswana or more the best guide or more use of these devices. A also no a or more share yen penny for. It's there before tablets in the two, there before phone and conduct any other. But my men sorry and enough for new credit that or that new credit. And how do you then tell the youth and they say, oh, a man yenesa. It's in a biono so a moshe. But now so at this year, I was here the moment. Say a the yes, no answers now. In P more with that population of Busha for there be any amount. Or no question, they say, I didn't in your mammy. As an explanation to me, but if we don't know the why behind it, the other risk can also say we try to as a the who show more the memo baby. Say about the son so now be anonym the actual why behind it. Then they kind of feel say, oh, Papa no Adam Amino, and as I say, oh, you don't even know why. Intina the trust level no ebafe. Kakra me de ya no.
That's super. Meko Dr. Kwame Chey, me say on sa was but me person the question ba kuma once. Now we are now the contribution our question as also. Elder Wilson able to some people exercise and they end up dying. Do we need a doctor's recommendation prior to engaging in a vigorous exercise? Elder, what does your mute?
Okay, thank you. Yeah, a very good question. Generally, almost recommend to say we are above 35. Now, person we exercise. We can take on human holding bar. As on no doctor, a call nya conversation. And no Dr. Ben Ekano. Be so much deficit. And then you want to jerk the body, especially the heart. We yes pa a day or how the bedding a bebro. And unti ubo modern say ubo o doctor. Now a day back question I me about could be busa anything na mama miss hasono. A day back question so say yenka the importance of physicals and wasem. Dr. Frank Huano Ewo se Ghana for say especially Ghana a treatment. MC Krum has your similar issue in our community. Say or sorry na no baby enye no yadia. Any when we say no hote. And only one of the misconceptions I person corrected with this addition yesiano. Say health in yet the absence of illness and also pain. Health here, a bra ya check one. Ne omo hu say bibia ye kama. Na medicine ejina enema be mi nsa bi so. Diagnosis, intervention, and a management. And what you say, obi yare krom ha no ko hospital and found say no CTBI, eso me labs. No mu what is going on. Or may no blind that you say if you call you no ano na ya true bi near the near the ama omo no krom asa. Because say omo border require that omo normal ranges are so you within it. And unti say we are outside of the ranger or intervention I saw the mao. And I say omo diagnosis so a bem with management send a beya send no chronic situation which me enya yarsa. Unti say the channel no more a friend is saying your tip pain. Sending out Dr. Ben kind of pain here, warning from the body. Or just say BB air koswa and yet. Now there are pain on behuno, now a advanced stage. No one can put yourself into a bigger disadvantage. What outcome is so precarious. One ya na a jinsemu. And unti and who hear my yenina or health insurance. Say periodically, ube schedules annually, ube call for physicals. Na bibi sorry oni pedua ni mu a. Why then? Omo timi ehunu, omo etimi aboan. But so be exercise there, by all means, you need to talk to your doctor, especially so when you send a menu here. Dear a branch betima and mimi timi sabium. Hey, when I was young, we timbo the whole day, and I mean timi sabium. And you know, I have to begin gradually. Sani mu be brave. Yeah, over 35. I person continue one. I see who your doctor. Medas.
That's by Elder. Ebeko Lydia Odum. Media team is just some bit me on me to Mama Lydia Odum. Okay. So Mami Lydia Niwa Yanko Eunice or Tommy Aqua.
Okay. If I talk, na me
Okay.
Yeah. Okay. Intino mesanso mechiamo na nyamisa mo pa woni mapa moye. Mwakasa bebre na mete hadi na enra no program aye an enyume about patient any doctor's visit in Adeno. On say for contributive baby about in funny reactions by be mammy so nanso not time no conti. Na me pesa me so me contribute to nia ye can run no kakra about me ankasa me experience with pain pill killer, and I say yeah the mommy hospital because near mommy who say yeah sure hospital, and I say before I go hospital you wouldn't more home answer who call doctor or but near me when you say be once they say a doctor no who feel say doctor didn't was say a ye be beer mouth. Sometimes no who visit one can no what prepare so we be call visit the wouldn't mean someone who can a boy doctor no money who near how na me koye surgery ewo ha na sa surgery no ye me na me be fie no na I was so much in pain. When we say we are surgery na we be fie ye follow up ye friend we be say what to say but that pain was so it was so bad. And you know ya mami nro ma be fie me fa na fe de bin to me cry na you my friend maybe so be ye we dey fa sa you know after 4 days we start here no na me to me after it was too much na me call back when say me mbra me buy no mo so ade o mo am surgery we no when so sense so ekwaye me scan biem your friend says scan biem o person mo hwe sa ade na mo ye no say bibi ankoya no mo e the camera hwehwe ho biem mo ehu bibia so mo say bibia you okay enti me nko fie na me nko so mfedro no na ebeko me be fie a me ntumi kura pain no me te wo bibia o mo aye surgery no enti na no kura surgery embolization o mo ntwa bibia but o mo say it was too much for fibroid enti ho no na me dwo dam sa e grow way na me fa me feel this I will na me fa I will deal with the pain like that, and that medicine is called Percocet. I tried me didn't no bon mo na ebia mo be hu but ne bono me to me pronouncing your friend of Percocet or something something yes Percocet or something the side no me share dey na me me fa bi da aha na me buy ya am surgery for pain yiti me fa okay e da man fa no pain no subside kakra Intin area no some say fa no man fa na pain no man te pain no too much but as normal me say so te ho na me say no e bi edure ya me fe mom na e ma de no ye kese sa nti omo frame biem no e na me say eduro no man fa ne na me hu say e me say no na ye na omo say sa okay and ya me fa me try another ba ku bi omo de ma me ye na me hu say e say eduro no mom na e bia na ntimi and the man send copy hospital one more send goes all through all this into no me the my advice and say ye my dry ya steady ye ho e dry won fa bi dan we wan kasa wo steady wo ho an so be boa ma we hu say ade e bia na ntimi abutre mu na wa call my doctor ne ayeyi secondly no obi ka autopsy asem ne ade but me na me ni obi di nkomo ewie ya Nipa no anya stage 3 colon cancer ama ne kopie India ya ehwe no omo hwe no neti onya ya no o starting kakra wo mo kwa na o man na edro wo mo si o bia ye bibi na o man na edro e wo Ghana. It took 5 years answer Dr. Nagsda ba say okay yen koye endoscopy o say dey omo fa camera nko hwe de ye koso ansa omo hu ye na ye too late na etu na stage 3 cancer mu ye ho hwea enhyeda nyame adoma na kakra enti no aha na ye wo no e privilege me nyame de be wie masam na ani e privilege say ye nya privilege na si educate ye ho wo time nyame so mo hia de a kire ye de ye no at least aha we are no hospital kram po a wo ye prepare ko ye be sure we am no down. But sometimes in your Ghana system would dear and the agent from compare her. And to say, na sebia, ye be down sebi. Nan send Jenny, you may know you sing the hospital cry, check up and cry a problem. your friend say exercise I problem. Ye dia me dim I problem dia. And me hu ni I pese ye nyame ye yembiem. Te me de me so bia nkrai say Nyankopon boa. Nyankopon aboa ye yi. Yen doctor visited there. Yen my friend dia go. Yen kona yen mo doctor no so no mo aye through God. Amen.
That's a I'm say yeah, time no it's trying to and keep the comments as short as possible. I don't know say Elder Tommy Akwane also send a wife and so ever so. Okay, well, yeah, I don't know, so Dr. Frida, if you want to pick this question. Obi Busa about fibroids. I say, can they be cured without surgery? And if yes, what do you have to do to cure it?
That's it for the question. No. My expertise is not really in OBGYN, but the minimum said it depends on the size of the fibroids. No, sometimes no, it's not always surgically removed. They'll give you some advice. Maybe I'll follow with your OBGYN and also doctor. They will give you advice on how to, advice on how to control or maintain or deal with the fibroids, but it's usually depending on the size, and they recommend surgery. In maybe more time, we can research that and get back to you.
Okay, I had a particular question. And the other consideration here, the symptoms, on say because of fibroid, on your menstrual flow now or bleed heavily more than normal. These are all things that come into consideration. And
it's interfering with your fertility, and so
that's correct. Yes, and come back maybe count. Depending on your age, and then your fertility goals and the meaning come into play. I know so there are people that promote ABB dry shrink fibroids and we should be very careful of that and your money. The best answer, Dr. Frida, speak to your OBGY. So if you need a referral, catch your PCP. Now refer to OBGY. They'll be the best resource on the answer. Dr. Elder Aqua.
Okay. Me that's a pa. Now, many might be first one on my contribution to inquire addiction from tablets in I didn't say. I've recommended to so many parents, they don't do it. Inquire no there a year pa, especially the child is in the language limited. And I pay a skills be a name be a person to laptop kitwamano. Na ye YouTube videos ebeboano in consultation with the child's teacher na teacher be was sorry na bibisa fagu laptop no so on here internet no etimiabo enti eno no eliminate akwara from playing so many other things here enye beneficial mano me no me second one here question. And then I make a South Korean beer, meneno about tennis. He's 68, we're very strong. Now, let me cast forward now issues, me de suggestions no man or the energy power 3. Now, I did be out I can say. So ran up our catcher muscle. And near my how thick I did be as a white beer a basono. A threat. The level of infections are body. And yeah, Jerry said, "We catch them as we clean it so Arabania and I and pay attention." And so catch them as so no, adiano, minim more than my doctors in the minimum. Is it applicable to us? What do you know? And they say, my question, I don't know that.
I don't know who wants to pick this up.
If you have a lot of stuff on your tongue in the morning after sleeping, it's just part of say your dad the body gets rid of a lot of things, and we go through changes, skin cells that die and things like that. In the mouth, that is just a way of your body getting rid of, potential toxins that need to come out of your body, and that's why we have to clean it off. That actually brings me to a point I want to share with our oral care. And say, yeah, na ya say, oh, one time a day now is okay. They have tongue cleaners that you need to use something to scrape off those nyamana okay from your tongue, because unless you have halitosis or really bad infection in the sinus, you will have bad breath. Because that stuff, it smells, is full of bacteria. That needs to be cleaned off. And if you have a lot of it, it could mean you have something going on and your body is just working to get rid of it through your oral cavity. The more the worse. So clean it off and have good oral hygiene. And now we choose and now we scrape that stuff off your tongue.
Thank you very much, Dr. Hannah. Ever called David Amponsa?
A doctor for ya damasipi. Yeah, what dear may and Dr. Frida, I will summarize it in the presentations, no? What can I say? Yen treaty breakfast like a king, lunch like a queen, and supper like a papa. Me say, Mammy White, and so I can't say bisa. Me a breakfast person. Me to quite 4:30 a.m. I made the breakfast before I hit the road. But my hunu, including professionals and doctors, you feel fear quite jumamu, no breakfast. Or so will be a be earlier, or better now about 2, no needy. And more problems in the saying, one way free fear and no pie, ye need breakfast, or better no way chemo lunch, corano. A problem, Madam say.
That's okay. I don't see any other hand. Men quite chatting will be busa maybe about cancers. Are there cancers that are hereditary? So Dr. Fried and Dr. Hannah and Sansenka, if you can bring it to the floor, no be and the benefit of answers now.
Dr. Hannah Oko.
No, you can go ahead.
There are a lot of cancers that are hereditary. Sanya Dr. Hannah named editorial. Breast cancer, colon cancer, prostate cancer, ovarian cancer, uterine cancer, some skin cancers, bone cancer, brain cancers, some cancers of the fertility organs, some cancers of the eye. So there's a lot of cancers familial, meaning say, so abusia need be titu if it's like parents, grandparents, sa line noir. There is a tendency or a risk so it depends. Until now, call Dr. Hona, they do the history. They take your familial history. I know Ghanaians were limited with sa history, but now we can start it from our generation, keeping track of those things. But cancers it is brought on by lifestyle. And let's say your family history, cancer in them. No, I could pick a bad habit of smoking or overeating. You have now compounded that risk factor for your tendency to get cancer along the way. And I hope Metimia answers our question. That's it. Meaning so Dr. Hannah will become one.
No, I think that's pretty much what you said. The other thing I can add to it, is also what we eat. Sometimes our exposure to certain food items, some canned foods that have carcinogens, that could also put you at risk for some cancers. Family name. You have to be careful of, canned foods near the use, make sure it's not expired, make sure that, as much as possible, eat more fresh produce compared to canned items, because also cancer. And Dr. Frida, that was a good point about the lung cancer. But then a lot of us don't smoke. So we think, say, oh, wait, I'm fire. Secondhand smoking, you want to not be around people who smoke, because secondhand smoking the crowd could be worse, because you're inhaling a lot of the toxins exhaling out, through you. And even though you didn't smoke, you've been exposed to carcinogens through that secondhand smoking. And as much as possible, you try to hang around with people who smoke, because we could be increasing our risk for lung cancer as well. Thank you.
Very much. Comfort's Galaxy tab.
I think that Dr. Frank.
Yeah.
You see, Dr. Mponsa, ABC question, no, you're addressing the question, no, about the breakfast, no.
Okay.
Yes, so maybe, I don't know, Dr. Frederick, you want to help, or see a skip breakfast, and then wait till later on in the day, like in the afternoon, before they take their breakfast, supposedly. What are the risks? Is there any problems with it, or he's trying to find?
Okay. Now make us all them more my advice.
Right.
So okay, just think about the body now. When you let's say follow some lifestyle changes now, bring it to the presentation, no. Say you've gone to bed emptier. Now I'm sorry, and remember, calories equal energy if you eat it right. What you didn't too much is stored as fat, not a cow so. But if you're doing it the right way, it equals energy, and energy is needed by the brain, by your vital organs, by so many things in the body to perform well. So what could that empty? You really do some benefits of making sure, say you have some hours in between time already dinner to empty. No, there are benefits in that. And if you see some of the fad diets now, like intermittent fasting and all those things, they recommend that long stretch of time because you're giving your body time to digest it, to turn it into energy for the body and all those things, the digestive mechanisms to work. But prolonged time of not eating, it does hurt you. You don't want to do that for too long. First of all, you are your friends say you're running on negative. You have not nourished the body with the energy it needs to function during the day, for the brain cells and all those things to function. It matters how many hours that you've gone empty. You have to make sure, say, you replenish for the day. You're also burning. And there's a point in there where you don't want to slow your metabolism. If you starve the body too long, it thinks that it's in starvation mode. It's keeping and holding everything is your friend is saying calories that the body needs. And we don't want the body to function that way. We want our metabolism to burn and not think that it's in starvation mode. It's trying to survive and hold everything. It may go against you trying to lose weight and keep a healthy weight.
There was a question in the chat about let me get the exact. Also, if someone is anemic and they eat too much ice, would they still affect them badly, Doctor?
Yes, I want to answer that question. So I used to have that problem personally because I have sickle cell trait, and for some reason, even though I don't have the disease, I have very low iron level. I used to, like to chew things, and you can't addiction wasn't. And I used to chew a lot of ice, and ice no crown so and so not things that have like BB to say other things that I will not confess on this platform. I used to chew, but on the ice side, it has a link with anemia. You're anemic or having the urge to chew ice. It is not good because chewing ice, can lead to dental issues. You can damage your braces. You can damage it. You can break a tooth. It can also damage your enamel, making it, likely to have cavities. Now, dentists, Becca say you have all these problems. If you can find another way, usually for me, when my iron level was low, that was when I craved for ice more. Inti say if you continue to crave for ice, that means your iron level is too low. Inti you want to get your iron supplements, and take them, because when you start getting your levels back up, the cravings will diminish, and that is what I do. And I've actually overcome that, but it's a bad habit. Inti try not, get yourself away from that addiction.
That's it. So there are too many questions. Dr. Pokobedi, I don't know if we can go till 5:30.
Yes, you bit might take more time. I think that I've been a binom eba. So that is the other thing we need to consider. So
okay, that's it. Yabefa Comforts Galaxy tab.
Anyway, whilst you're waiting for Comfort, and I think
hello. Okay. Media nankasa no na enye question as such, but time na ye about breast cancer no, and na me was just contribution. Say ye him say cancer everyone or family, but recently no, you realizes that it's not that. Obi oho ana oni family history. Nanso no wenye bi. Na the mpese me kama ye nua no me spare man ye hu ne say cancer no, it can affect anybody from 18 years and up. First, name say you're paying for into the mesra almost say be a young person now or a monthly self breast exam. Now so feel it lump and also feel any change be annual. My young can say me you're young, na mean to me your breast cancer. Now your mom don't say be who your doctors no more checking and early, because early detection is the cure. Intermediate down on person make and yes, me question be I just contribution to me that must say.
That was Dr. Ben.
Oh, I think that what they take the questions anyways.
All right. Mercy Ajeni Boating. Mami Mercy Ajeni Boating, but you wait me on meet you.
Hello.
Yes.
Okay, Mpacho, what you mean? Yo, Mpacho, first of all, no, yedamasipa ewo. Sa introduce ya mode my bet. My question is say, I don't have problem falling asleep, but it got to a time about 3 months ago. Me da maybe 2 hours through my sleep, no. Bibi anyeme and Johnson me na meniate. Benitia, a bet me taking me about 3 hours. Na mintimi follow asleep. Ebia many be say ebe kumno na malama boom ne was some sorry kwejuma. Sometimes so ebia na me sorry kojonso that would be it. Intina me pese me who say any health issue that is causing that problem na because I don't have problem falling asleep. But in the middle of the night, and no one near it.
Okay.
Me that's it.
All right. Dr. Hannah, but you're
Yes, I can do that. So what you're saying is that you have insomnia. Insomnia, no, trouble either falling asleep or staying asleep, and it could be a result of different things. Maybe a short term because you might have something underlying going on that you don't know. So again, no, maybe a wako now doctor na your physical or be run a test. Number who say be a levels of normal things are here say well in order, no, are not in where they need to be at. You bet me ama supplement to be to help you with that. Now say continue for a long time, maybe more than 3 months, 6 months, or no be then you'll be worried. Say you're on and off for the sometimes we all go through that. Once in a while you have just sleepless night, but if something consistent, then I want you to talk to your doctor. And something I can recommend to, again, we're making recommendation. Your hormone be a friend of melatonin. That is actually what helps us to fall asleep, stay asleep. And sometimes that level may be less and, maybe compromised as a result of other things going on in your body. And I can recommend that to you after you talk to your doctor. You can start off, they have very low doses, over-the-counter melatonin. That might help you to support you through that process before I be able to doctor or something. Just make sure you read the labels, talk to the pharmacist, and get some advice before you start taking it. But that's what I might recommend for you in a short period of time to help with that until Dr. Bekasa. Yes.
Okay, all those are perfect. Now, one of the things you should also look at is doing like a sleep study. ABI, you might have snoring. As we go older, some things pop up. So you might have sleep apnea. And you want to check, say, ABI said, ABI, maybe you sleep alone. So ABI won't realize it. But if you are married and you sleep with your husband, maybe they can observe you, say, or you snore loudly or it's becoming intense. That's one aspect. But if you don't have that, everything Dr. Hannah said was on point. Intimidase.
Unless our husband in the
Okay. Butters family.
Hello.
Yes, sir.
What do you can you the money answer? My question is let me a driver and I will labor year Jumas or no cigarette pa last year. Me try say no be jai. If this year the iOS cry. Me castle in Jaya. I feel me say on tries a truck in Gramporon. Yes, sir. They be a mecha and a panel on we ever just say. Some I can't improve my reporter, my boss knows. But yes, sir. And a panel on here, a year queen, was saying. So I don't know how to go about it. Timo can't win us some no. I mean, bring this question and see. Oh, yeah.
Dr. Pacho, answer will be very answer, no, right? I want to add this. So yeah, you might home health as a home health aid or home health setting. Local patient if you next or no jot and so how do you go about it? Me percent be they can bra question on that yetimi eboa. So when your condition does not
question to you what answer in your mind.
Okay. I've worked in that role before and me face that challenge, in most cases, say yeah, assignments and what I do, they say I let them know that I cannot stand smoke, right? We say so now they say we look at also ye into when you let them know say it's not healthy for you for X, Y reasons yeah, not agency they consider. The other thing also said to say situation, you can let the company know. Now, if you are a doctor, then your doctor can also give you a note if there's a clinical indication. Give you a note to say this person should not be around such a person. Not affiliate or more to me associate no amount because you should not be a victim of the circumstance, right? And my points are not my person making you say if you find yourself in a situation where and yet say many cigarette for net na hono ma me pamcho pe akwenya foforo so a ubetumi e de nya exemption from it and yes na say the edika kai no second hand smoking also is very dangerous.
Yeah, well, only 10 minutes. And they at 5:15. And me who 3 hands. You fast at 3 no. We are now, yeah, wrap it up. And the next one, a Deuce iPhone.
Okay, I make now we be a question. We say young, yeah, what no is a one cleaner. What I said, some of the consequences be beating me about. Say one to me and keep you or no come, especially in the morning. There are so many bacteria and so many activities here. Of course, in the night, and when bacteria and be collaborating me for lymphatic vessels, it me a kidney collaborating me so many complications or kidney be a bit many condition be a friend glomerulonephritis. Mostly no say poor oral hygiene no and it may confess but no people say we have fibroid. Fibroid, there are so many ways you bit me. They are treated without doing a surgery. The friend is artery embolization and obey injected the friend's embolic agent. Amanako artery supply the uterus on the side na fibroid no. Say you block it, your friend say artery now. There won't be any blood supply to the fibroid tissue. Means a shrink, that will be the dead of the fibroid no. And we say a question be a fasting home. Say usora no pa na wundidi a yanka hu se body no yankopon aye ne say in every sequential ways beyond the body needs secrete certain of substance into the intestine. I say they are ready to digest. And it's a wundidi tembia wundidi a body no kwa betimi a secrete AC hydrochloric acid a eno no wo your friend is stomach ni mu a eno so betimi a cause corrosion of the internal lining of the gastric tissues. Now, one 3 year, ubetimi develop your friend is a gastric ulcer. And when in Sanya we say say your bomodian didi in a normal way and PBBD and no uncle and chill with Yamukom. More now watch with Yamukono. One okofa another yadie as I dear bound. Anna baby is never fat and now who say na croncro achino. And now croncro ni bo hona yana ayadrene. Say what you say well be hot my old drinking near my building drinking near my building near my beer or called out in Mopitri no one unyani the corona drink best be sweet trimintino and my wound timing at the untimina and most in a yana stress is also most of the contributing factor a yana and my nancro etimichia yintimina jo medasi.
All right, Colin said that was a very technical contribution. I mean, sure. Suzanne, let me say what was that question back? I mean, encore Evelyn, if there's time, I'll come to you. But Evelyn. All right, so you're ready. Encore Suzanne.
Me patch me that say me bisa question way because now in madam fi be na ye kan wase na e margin na ono no he's always the gym or the exercise or your way, but what I see is no, he's not working on his cardio, just working on his body. I'll be good body, so when you say packs in your man. And I mean, I say sometimes you're doing all this, no, it's not help. Say it doesn't help, but you say you were working on the cardio, can be good for you. It can be a good way for you because it's like you are cardio is best exercise for everybody. Because sometimes when you be or fitting the bus, on to be on to full steps, 100 steps. But you also walk on more do because every day we are not working the cardio, so with move full 100 steps. Let me say those people now they work on their body, but not the cardio, And is it good to say yes or yes, sir? Now say it's good for both the body and the cardio. Mr. Mutiasia.
Okay. Dr. Ben.
Well, my main Susanna, thank you so much for your question. I think that one of the things, and I'm so happy to say what this our question by. Yes, I've seen quite a lot of things, and I know that men are the most guilty of that. We always want to build those pecs and muscles, just to show off to women who don't even care sometimes about these things. But yes, getting to build those muscles is good. We need muscle strength. But like you rightly advise him, we had the cardiovascular endurance. It is so critical. I've had so many times they've been referred and they've come back to us with so many problems just because of that. Even some of them get caught up in building so much strength and they lose the flexibility part. As a mechanical principle of fit, the frequency, intensity, and type. Mostly I would advise people say, the fitness, cardiovascular endurance, they need to get it. It should be the basics. Then you can build on the strength, the flexibility, and then the balance and coordination aspect. Maybe another time we will discuss those parts in the two as well. But for most of the men, we only go to the gym, so that we can show off and say, I work out na yakukru na DM. One of the things I always want people to understand is say, in Adiana, yes, you want to build muscle mass, something we call hypertrophy of the muscles, but you are not an athlete. We are not doing for sport. And you know, everything you talk about moderation and also you see people after the map, you're so pumped up and they say, some of them get to a point, it start actually occluding some of them. In fact, in dynamic, one athlete be a minimum, a cutting off the blood supply, so the leg have to be amputated. No, your Olympic, they had to amputate because of that. Because muscle mass and just occlude, because can say, muscle mass and blood vessels and nerves and nerves need three things. Now, they need mobility, they need space, they need blood supply. Yes, the compartment syndrome. Thank you, Dr. Hannah. They have that. Also, when your tunicate effect, it cut those things off. So you need a balance of the strength and the flexibility and then the endurance. And it's like you rightly said, you can have bariatric people. I have one professor who is shape physiologically shape in society. But anytime you're back any annual physicals, the biomarkers are always within normal ranges. And sometimes, I always tell people, say, the look does not predict the taste. Sometimes the plate in this Philip Bebe me out. The anene look at corner, but tobacco didn't and quay about cry. If also it doesn't look, some feature of the end and Cahonia, oh dear to say. A whole DNA come
until you watch your side enough. Got
so and also what they're saying is yes, they look that sometimes even like we are talking about the weight loss, for some of us, you might not physically see, say, you shrunk to problem eye size. But as you consistently do that, and then I send you can, we'll take you, we'll pass history, and then I will compare. Most time we don't give ourselves so much credit. Yeah, who say you shrink, come up to say petite body, you're say we've done nothing. But just the annual physicals who would tell you first and nanka or calorie level no what this was say won't say ninja shall say drop within normal range. Yes, your body size might not have changed, but you've done so much to make sure say your body, your what they call it, the biomarkers are within normal ranges.
All right, Dr. Ben, that was a show. I think that we only have 2 minutes. Maybe that question, Solomon was a while back. Or say you bet me I sustain these presentations because some more treacherous are not you make quick changes, but after a week or two near the area fit. You better than yet me sustain these programs.
Well, where the pastor, I think that Pastor Samuel our platform is so Pastor. Can you unmute yourself and show your face? I think that we are almost. Pastor Samuel is our zonal president for the Nagsda zonal president. But we as the health department, we'll do our best to make sure say we are so happy for us, so thrilled to say this program has been well accepted by your audience and your presenters and have been so phenomenal in bringing this. And Dr. Frank, what we have right now have been very enriching. We can only, we cannot make any promise now, but we hope to say with what have just happened with this, we can probably find way of continuing with this. Looking at the time of our presenter, a lot has gone into them preparing, and we've taken quite a lot from them throughout the week. And I know, sir, we want to put in a say, I want to safely say, sir, they will be willing to come so that at least we give them next time. My friend Philip and Dr. Hannah can say, yeah, young Ghanaian musician program in 20 minutes.
Call because that's stressing me out.
And we will try as much as possible. Say, probably, if not quarterly, probably we see if probably maybe annually we can get to do it. We will think through that with Pastor Mo permission. That's what we hope to be able to do.
All right, thank you very much. Pastor, I be invited for closing remarks and a vote of thanks. So wait me on me too, Pastor.
On mute to me. Good. Madam Wasibebre. When you comment in a buy and I say, oh, mommy, chance to do my
wait me out the name Afra.
Oh, me fanny Afra. All right. Madam Wasi, as a matter of fact, the all kind of change sustainability, no. It's help presenters, Nadia, you have really done your part. More year, more fem dear. The only thing they say, Yenia ye no. Enna, SSE to me the Bobra. It is a preaching. We always preach. We preach the same thing from the Bible. Every Sabbath, ye preach it, tight promotion. It goes on. But ye FM dear, intimonso, moya mo fem dear, moya dear. You can only do what you can do to help us. The only thing is say, yeah, I absorb what you bet me a putuno into practice. Having said that, honestly speaking, wow, I have personally been blessed for the past 7 days. Moya dear papa, when you made the moya juma kese papa, I'm so happy. Say you young people like you when you me eshramo na muesia dia kwe chiri na muputu mwadisiwa muesia into practice just to share with us, especially fa apomdenho abua mi peye na minimise audience nonso abua obia nti on behalf of the Central Zone pastors and the executive committee and also Safu Many, I just want to say thank you. And also to our audience, say mwetimi a support to your health evangelism programming. Amene do sabri. As a matter of fact, time kwadi mama mi break it to a be na memphasasi day emma and we your health leaders. Our Central Zone, Dr. Bidiakon, Dr. Frida Osei, and then Mrs. Alberta Kuma. Because they got together, put things together, and then assemble these presenters. Wonderful, wonderful presenters. As a matter of fact, feedback is so very, very positive, encouraging. Dr. Kwamche Jemfi, Dr. Benjamin Opokubedia Komo Udimbio, Dr. Frida Osei, Dr. Hannah Eu Asim, and then Dr. Filippo Fori and to me, and then Dr. Kennedy Donko. Yet Damwasi Bebre, when Yame in Shram. Now be can our chat room for say, how can we pay them? Yes, sir, when Yankopa Dumini in Shram, because we can't pay you. Naminim say when Yankopa do betting me a Shram. Ama mwejuma moyensu bibia koso kama. Ebio, ye better immediate team nonso asi. Unia Emmanuel Essien any kismetenom any Dennis upon Chichiku Moya dear yepa because a medie bit makoswa jese muboa yeni. Because Juma Weni a here technical team always you should be on point. Now you guys have done extremely well. Yenia so dear Moya pa. On top of it, your outside media team were almost a boa cover sa programming. A year Yonkodo TV. As a matter of fact, a bright message you come out woman, any Hope TV. They are very short, but they agreed some better partner with us. Now, many yes, sir, Jumedie. On top of it, yes, sir, in your Hope for Life, almost so boy, whatever media, and then era one. Now, Nebu High, and can't Jumedia Weddy. A year Knox Studios, a Ghana, only desire flying. On top of it, and also so almost apart from so we design flyer and Ankasano, woman boy with the backdrop and support. Into Omwa boy ye pa ama Jumedian so ako kama. Na said ye mekayeno, this is not going to be the first and the last. The other topic and I'm a person we deal with any oral hygiene by any other stuff. Now we are hoping say in the near future. Ya bebo modia se ye besa aye enshishe na mwetini asa abeboye na jumedie nunso etimi akoso. Na bavo besem daye audience nasi. We can put good programs together, we can execute it, but if people do not show up, then we don't have any program. It's like you go to church, you stand on the pulpit. Whom do you preach to? The church members have to come. The audience have to be there. And especially Ghana, across North America, we want to say thank you. Thank you for supporting our program. Yes, say na onshramu. Ya damwasi bebre. Medemano Vesiha.
Amen, Pastor. That was super, Dr. Ben.
Pastor, thank you. Yes, say a fair chini abofono. Sana I can cast 7 years back.
You refi Bibia now the account.
Pastor, where the employee first penny the Jaria Nanka in Suya Asa. But near Bekan said, like you said, will not say much. But on behalf of your team, the various health department and what all the churches, we want to say thank you so much. Some of the notices and then your money came quite late, but you didn't turn your back on us. You've really supported us, the various church, and the leadership, you've been so helpful for us to have this program. Like Pastor said, without you, we couldn't have had this program happen. People like Dr. Nkrumah had to come in.
Oh, yes. Hey, Samuel Labte, Mauro Infino.
Yes.
Hope TV representative for North America.
Yes, we have to pull him all the way from Ohio. Sameh has been spending time with us during the backstage, guiding us what to do with our media. Anyway, he's been so phenomenal. Dr. Benjamin Nkrumah. We are so grateful to these people. And there are so many people who play roles in diverse ways to help us bring this program. On behalf of the Health, we cannot thank you enough. Yes. All that we can say is say, the usual faces, yes, Oliver Trace will always ask for more. So some not send a pastor can not in the too distant future. Samoti and Cassie Yabomo 90 say your audience nam yes so say Yamra country say they need more of you. Na my bombodiana my so we want to say thank you. Any good thing that has the beginning has an end. We're drawing the curtains, but this is not a goodbye. This is see you next time. That is what probably I'm gonna say. Until when I know say at least there have been 2 things that you picked from here that you're going to make lifetime, and maybe probably on our next time, we'll be taking testimonies and in researching a pre and post test. So this is what we are going to put those things in here, pre and post test, to see the effect it has had on. And I think that it will be a very great feedback if we can do that, and then use that as own Ghanaians, the effects of some of these things, And say, our presenters, God bless you so much for all that you've done for us. Amen.
Amen.
All right. Pastor Eddie, what the closing prayer and benediction?
Yo, my mom paye. Yeneja wasro ye dawase. No kwase mini unyamede fo aye nhihye papa maye na wotwi ama ye ho adwiriye. Ensem wa yate fa apomdin nhihye ehu. Nyamede fo tore bia na ye de adwini ye susue no aye niema. But we die wona madum so shira Dr. C amomo kan sembebre na kaya koma. Na said wo kan we want to make lifestyle changes, Ya jisa we nyankopon kuto na betimi ahye din. Osoma for Paul kan wesimitimi ade nyina ye. Wo Kristo a wo hyemedin mu. How to sustain the wo Kristo wo na modum so am ya tiefe ya bimfo ye hoi. Yesre din shekese. Encouragement ne support pa winyamo hon konkon betimi dia maye. Na fe yensu betimi aye determined intentionally. Ne betimi edi de ye tie nyina eso. Enti awrade yesro boaye na hye din enti mase yesua de ete se na wotwi na fe bi jemu agu honomo emmasa awrade yesro hirayen ebi o ye woni pa bibre we mu a ebi a wo nso eyare ebi a yentimi amma won kwa me won ntimi anka won yare ansre winyankopon wa ho den ene wadum we say physically you heal us, spiritually you work with us too. And the 2 million ayara sense of the winyankopon will be biara utimi ba na wotwi no huna mani woni video or try doctors are but winyankopon so hu mambobo yes so wayare said to me enko bibia we here ayara saso na obia ho ntro no ne nya dwene mu mfofore ni pedua mu akwa hosan akoma mu anigye ene ne betimi aboa ya me yetimi atena se ni asom no kuremu na udwumadi nso a wode ahye nsa na timi akoyie enumere ye the presenters yi nyina hye wo Nyankopɔn nsa wa bre no mo asɛ mere nso wɔ ye ho ewurade hye wa hoɔden anamu ene wo mo bre nyina media team ne wo mo cover ye ne obi biara wo boa ye bia wa hwere ɛwɔ ye ho nti ewurade esro se hyira wo nyina audience nso ewurade omo ma ye attention so ye do mu nyina hye wo Nyankopɔn nsa hyira wo bia ma ye the ebitima kan sɛ osoro hene bagye wa yeye no waseda ɛwɔ de wa yama ye na wɔtwi menso aba bebree moho next time we be share said your may kan na feed your ma bebree dia dance ɛwɔ de wo Nyankopɔn wa yama ye enti anumre if you will bless us indeed and enlarge our territories, place your hand upon us and you will keep us from evil, that we will not bring pain upon ourselves and others. We thank you for an answered prayer because we ask it in Jesus' name. Amen.
Amen.
Amen. Amen.
As a way there, because the coordinators, we forgot to remember the coordinators now.
Yes.
Yes.
Yes. Dr. Frankie said they are channels. He's been yes.
Thank you
so much for all the
Happy Father's Day to all the women.
Oh yes. So Ben, you can see Rebecca to everyone.
Oh, share Mother's Day na mbwaye.
Yes,
tomorrow every woman should take a break from the kitchen and de-stress.
Do they have to exercise, Echna?
They should, but not cook. Bye.
Right. Oh, bye.
Recording stopped.